Good morning, everyone. I think I'll start the webinar now. Good morning once again, everyone. We're so happy to have everyone on this webinar this is one of the first webinars that we're having on the Nigeria TB screening and state engagements with voices on the field and from the front line of TB case detection in Nigeria. And we all know why we're here today to, share ideas and discuss to know what we're doing very well on the field, and as well as also discuss on the challenges that we're facing on the field during our TB case finding. I don't know, am I audible to everyone as well as we're going on?
Yes, we can hear you.
Okay, awesome, thank you. So, since we're just a few minutes behind schedule, I will quickly want to introduce the moderator for today's webinar. Is the founder and CEO of Janna Health Foundation in the person of Dr. Stephen John, and I'll be handing over to him to take over the moderation for this webinar and all of that, and also to introduce the panelists that we'll be having on today's webinar, who will be listening to as we go on today. Thank you so much and welcome, Dr. Stephen.
Thank you. Thank you very much, Cherichi Onoha. It's a pleasure to be here. So welcome everybody to this very interesting webinar. And honestly, when I saw this webinar being advertised, I knew that I must be part of it because this is what I call the game changer webinar. So Cherichi, should I go ahead and introduce the panelists as well?
Yeah.
Okay. All right. Thank you very much. So, but first, I think we'll have to, I'll start with giving a context before we come to that, we all know Nigeria's place in relation to tuberculosis. It remains a huge public health problem. And it's not news that 15 Nigerians die every hour from TB. And in total, annually, we have over 125,000 people dying of TB in Nigeria. So that is a huge problem. So Nigeria ranks first in TB burden in Africa, sixth globally, and then we account for 4.6% of the global burden of TB. So we have to do what we have to do to make sure that we change this narrative. It's not a good narrative. So of course, we know that several other strategies have been implemented over the past decades to try to address the problem of TB in Nigeria. And one of the most important strategies is the active case finding, which is happening in different quarters implemented by different partners. So innovations like digital chest X-ray combined with molecular testing, that is GeneXpert, for example, is being deployed presently through mobile unit, and this has been on since the past COVID, after the COVID period. And this has served actually remote communities, underserved communities across the nation. And while the national momentum is building, we know that the state level implementation remains uneven. So in some states, you will find a good performance. In some states, you have average performance, and in some, you have below average performance. So to really close this detection gap, to make sure that we become more effective in our interventions, then the state leadership and the frontline action must be prioritized. So this webinar is designed to spotlight just that, and then make sure that we share the experience and knowledge we have garnered from this particular exercises. So today we have the objectives of this webinars are mainly 4 of them: to elevate the voices of state TB officers and frontline radiographers. You will hear from them. And also we hope to highlight what's working in the TB detection, what others can learn, what can we learn, And then the third one is to explore challenges and common pitfalls in subnational implementation. And then lastly, we look to facilitate also knowledge sharing between national programs and the state implementers. So in this particular webinar, we have 4 key people, panelists. We have Dr. Eze Oka, who is a country program manager for the PDX Impact Project. And then we also have Ms. Mary Izokpu, who is a radiation safety officer with KNCV in the PDX Impact Project. Then we have Dr. Kayo Akanga, who is a state TB program manager from Benue State, one of the most challenged states in Nigeria and one of the performing states as well. Then we have also Mr. Salisu Hassan, who is from Gombe State, who is a team lead in the mobile PDX trail. So I think now I'll hand over to the next person. I think I'll call on Dr. Eze, to take over from here to discuss the next, what was that? Yeah, so Dr. Eze, over to you. I think you have to come in here and start this process going. Let's go.
Okay, thank you so much, Dr. Stephen John. You have actually opened up the discussion for us to see where we are as a nation, position as a nation as it regards tuberculosis. And normally, if we continue to do what we've been doing before, our situation is not likely to change. And that is why the AI implementation using the portable digital X-ray is a way to go. It is not the usual. It is not what we're used to doing before. And then, of course, introducing this, we position these the knowledge barrier issues. That is actually the way to go when you look at how sensitive the AI is in terms of picking presumptive TB. And that is why we have welcomed this in the country, and we are doing our best to get it fully scaled up in implementation. Like you rightly said, some states are doing quite okay. Some are trying to catch up. Okay, but we know that if we have the time, if we give it time, every state will obviously be at par. And then in optimization of AI in TB diagnosis in Nigeria. So I would stop here and then wait for further guide on how to go to this.
Yes, thank you, Dr. Eze. Now I have some specific questions I would like to direct at you before we get to Mrs. Mary Akpo. First, can you walk us through how your team has successfully implemented AI solutions at the sites you work with at the moment?
Okay, thank you very much. Looking at that question, implementation of AI across our sites, I won't tell you that it has come easy. It hasn't come easy. Reason being that most people in the sites and in the states are not even aware of this sort of innovation. Yeah, in KNCV Nigeria, we started implementation using AI as far back as 2017, but the reach is very, very little. We can't get to so many places with our implementation, but coming in with the upscale through this GC7 grants, the impact project, it necessitated that we have to move across all the states. And now going into this state to implement, there is this fear, you want to use computer to make diagnosis, of tuberculosis. So the misunderstanding is there. Clinicians, originally even felt that this AI is going to cost them their work, because once you introduce computer into what you do, everybody becomes jittery, becomes scared. Okay. And then it took us, continuous advocacy, looking for community heads, political leaders, to demonstrate what we do so that they will understand that this AI we're talking about is only going to help us, get quality presumptive TB. that the results we get from AI are not definitive TB cases, that our clinicians still have their role to play. Molecular diagnosis is still going to be in place. And all of these are the things we did. So greatly advocacy to communities, advocacy to political head, advocacy to religious leaders, advocacy to stakeholders in the country. You recall when we had the stakeholders meeting in trying to fashion out ways to go with the AI, where we brought in, even the National Nuclear Regulatory Agency, into the meeting, all the partners in Nigeria implementing TB, brought in some clinicians, radiology, and there was a clear understanding to show that this AI is not really going to affect the job we do, rather it's going to enhance the job that every one of us do. And truth to it, we are beginning to see that in the field, because as we move into those communities, we invest with the doctors in those communities, the officers, the local government TB supervisors, the state program managers, they're coming to understand what we do. Based on this advocacy and understanding, the AI implementation across our sites, I can tell you, is becoming better as we go by the day. Tomorrow, promises to be better than today. And that is the kind of story we can tell you about it. Thank you.
Thank you very much. Thank you very much, Dr. Eze. I see you bring out the issue of fear of AI taking over, and then, of course, with other challenges as well, and how advocacy played a critical role in addressing some of these challenges among professionals that that really had that as a challenge. May I ask, in your view, what does a successful federation, state, that is federal to state collaboration, what should it look like, and what can be improved to scale TB detection more rapidly across Nigeria? Now we're looking at the federal and we're looking at the state. So that collaboration, I remember in that meeting, of course, we had key players from there also. So that kind of collaboration that we're trying to paint in Nigeria, what does it look like? And how can that improve our efforts to addressing these issues?
Okay, thank you very much. Great question, and I'm happy that some of the people who I see here were actually part of that wider meeting that is bringing both the national and the state to collaborate. But it's even beyond that. Okay, beyond the state's program, beyond the national program, we also have some important key players, in the field of TB. We are KNCV as an organization, but we also have the other organization, the other sub-recipients, and the other partners who are key players in the field of TB. For instance, we have Institute of Human Virology Nigeria that have engaged sub-recipients to carry out community CPPM, across the country, and they have their SRs. Okay, all of these SRs are all partners when we talk about tuberculosis fight in Nigeria. The AI solution is structured such that no single organization takes credit for what is done. It is spread across so that every partner, every SR have a say in the project, have an input in the project, and then based on that relationship with the SRs and the partners, okay, the community-based organizations were also brought in. Okay, so at the end of the day, there is a kind of linkage across partners, across community-based organization, okay, across state program, across, different sectors. The essence of this collaboration is to ensure that all hands is on deck to allow us work in synergy. If we're able to create that synergy that we are creating today, okay, then we are going to achieve more. And what has made it possible? It is possible because the National TB Program has created that platform and brought everyone into that umbrella, to allow us to function seamlessly. Are there challenges to that? Yes. Okay. There are challenges to that. It is seamless when you say you want to work alone, okay, and then you have control over every aspect of the program implementation. But your reach will be very limited. How many states can you cover? How many local governments can you cover? How many communities can you cover? So the delicate balance of working out, a relationship, a collaboration across state and national, across partners, across community-based organizations, across relevant key stakeholders, and then also bringing in the different manufacturers, bringing in different local partners, okay, into synergy, okay, because the most important thing is to close the gap, in TB diagnosis, which is what is keeping Nigeria ahead of the world in the negative direction, of being ranking 6th, among the countries with TB in the world and #1 in Africa. So what is facing us is such that we have to come together and, bring in that synergy to end TB in Nigeria. And I think so far that collaboration is working for us. The understanding is growing, and we are getting to understand day by day that every TB case will diagnose, and bring to treatment, prevents 15 other people from contacting TB in Nigeria. And that is the mandate that we have, across the country. Yeah.
Thank you very much. Thank you very much again, Dr. Eze. This is very clear. You spoke about shared collaboration in AI deployment. Yes, we have seen that, and it has helped a lot. And also remember, this is why we had a great leap in our case detection, case finding efforts across the country. Also, the issue of strong partner collaboration with NTP and the federal and the state also, all together leading to a synergy to close the gap in TB case detection. Thank you very much for these very clear responses. So now I'd like to go to Mrs. Mary Izokpu, the Radiation Safety Officer. So, Ms. Mary, you've worked closely with mobile TB screening teams, the teams face, and how do you address these challenges in the field? Over to you.
Good morning, everybody. Good morning, sir. Thank you for inviting me here to this beautiful webinar. Challenges across the project with different team members. It's always been something that there will always be challenges, and my role is to ensure that every challenges that they face is I try together here with my team to ensure we meet or overcome those challenges. Challenges comes in different aspects. We have the challenges from the implementation itself. We have challenges with the technical or the PDS units itself. We have challenges in even access to communities where they are going to work. We have the challenges from logistics. So each challenges and how it's also cut across different states. The challenges you have in the north may not be the same challenges they have in the south or even the north central. They are all in different forms. But my role is to ensure that all these challenges, whatever form they come in whatever way, we come together as a team, and not just the central team alone. We have so many partners at the state level, the NTP at the state level. We come together with so many people to ensure that all these challenges are being taken care of. With the implementation so far, another thing that the challenges have helped us to do is that as the challenges is coming, it is also making us to know how better to deploy this equipment and how to ensure that it's becoming safer and smoother running. Thank you, sir.
Thank you very much, Madam Mary. I hear you clearly. You spoke about challenges related to logistics, PDX unit implementation. And of course, it's very important that you mention the challenges related to different parts of the country, because we have a lot of cultural differences, so definitely each culture has its own protocol of engagement, and then before you even go to the level of deployment. Thank you very much. The most important thing is that it makes us know how best to really address this particular issue. And may I also ask you another question, that how have AI screening solutions impacted patient access and early detection based on what you've seen firsthand. So I know you've been to hard-to-reach community, difficult communities to work there. So what did you see? What did the AI bring to them?
Wow. AI has supported a lot of, or let me say AI reduced the time frame in diagnosis of TB. You know, when you do an x-ray in a typical x-ray department, you go there, you take an x-ray. They don't have the possibility, especially when the radiographer is not experienced. They don't have the ability to tell whether this is a TB, whether this is another chest pathology. They don't know the differentiation between all these pathologies of the chest. But with the AI incoming, you can immediately say, it will just tell you, oh, this person is susceptible of TB, and you can just go to the next phase of the program by taking the sputum and sending to the lab immediately. You don't need to wait for a radiologist to come and confirm, oh, this is TB, go ahead and take sputum for sample. The AI has not also reduced the time frame. It has also helped in convincing patients that they are not feeling fine. You take a chest x-ray, they are walking about and they felt that they are good. But when you take a chest x-ray and either you show them that there's something wrong with this place, and you just show the patient or the client and say, okay, even though you are feeling fine, but did you see what this image looks like here? This machine is telling us that your chest is not really too clean or too good. Would you please permit us to do another further test? That is what the AI has preferred us to do. Apart from also making sure that we have quick diagnosis and in TB patient, reducing the time frame for diagnosing TB patient, it is also a tool that we use in mobilizing in the field. When somebody sees it and say, oh, this thing was able to tell me what is wrong with my chest, before you know it, they are telling others, and before you know it, a lot of people come together to come to the outreach to perform their chest screening. Now, the AI in terms of to the clients, that is the advantage, but to the radiography profession or to the tuberculosis world, it has also helped us to bridge the gap in that missing TB cases. That is what the beauty that the artificial intelligence brought about. Patients that would have missed through passive case finding, the AI has also breached that gap. So we are able to diagnose more people easily than just doing chest x-ray and waiting for radiologist report that takes time due to the amount of radiologists that are in the country. Thank you.
Madam, thank you for highlighting these very important points here. Of course, reduction to time to diagnosis compared to the regular chest x-ray in the facilities, very convincing for clients, helps mobilization, bridging the gap between addressing the issue of missing TB cases, people with TB rather. So of course, motivation of attendance, of course, it's able to draw in people. I've seen that in the communities. And I think one area that also needs to be highlighted is the trust that is able to build from the people in those communities in the health system, because they now see you deploying this wonderful tech out there, which addresses the issues quicker than what is on ground or what we had before this advent of this particular diagnostic kits. So thank you very much once again. Okay, I'm asking that we have seen that Gombe State has consistently achieved strong screening numbers lately. So we wanted to hear what factors what did you put in place to help achieve this particular success?
Okay, thank you very much, sir. Good morning, all. Firstly, I would like to thank let me say, State TBL, because all these things happen due to their cooperation and their support. Actually, it has happened because of the level of, let me say, planning, because before an outreach, we have to sit down both with the state program manager, the CVOs and also the local government supervisors in terms of TB detection. We have to sit down at the last of every month to like plan for the next month. Okay, we will just select some target community that we want to go and conduct our outreaches. Then we plan, okay, who are the head of these communities? We now shortlist the head of each and every community we want to like visit to find out, okay, this is the heads. What we normally do, 4 PDX machines were deployed to the Gombe State, and this PDX machine has been shared according to the 3 or 4 geopolitical zone in Gombe State. So, and the people working with each and every machine and the locality, we assign people that understand the languages and the like religious belief, cultural differences. We assign people that can communicate very well with their language to that community, so that at least if you go there, you'll be able to communicate with their language. Speaking with their language create a lot of understanding, and then they will get, they'll give you the listening ears. So we will now sit down and organize this working plan. After organizing our plan, then we will now say, okay, what we are going to do now is to pay a courtesy visit to our to the district head or to the community head. Then we now go and describe what we are coming to do to his community members, and then explain everything that he needed to hear from us, and tell him the advantage of this program, the advantage to his people, and then seek his consent that we are coming to do this outreach. So after this, then we will now, okay, ask him, because you know now this is, it is now during farming season. So what we need is the participation of the community members. If you go there without informing the district heads, what will happen is that you will not find anybody there. So they are the one to mobilize the people. After paying a courtesy visit, then we will now ask him which date is suitable for the community, is suitable for him to come and do this particular outreach. He will now say, okay, you know, our people, mostly they are farmers, they went to farm in the morning. If you can make it in the afternoon, around 2, 3, or 4. Sometimes they will even suggest Saturday, Sunday, because it's the day that their people are available. So we have no any other option than to compromise our time to see that we make it to that time. So after this verbal discussion with the district heads, we now come back and then sit down with the state program manager. Then we'll now, okay, see what we are going to do. This particular community is a little bit risky to go there in the evening, because before you finish the outreach, it's going to take you like up to 8 p.m. or like 10. So with the kind of this risk situation, are we going to still go into that place? If we now wait between the, like, the benefit must outweigh the risks, then we'll now see, okay, we'll now try and like make it, if we are to close by 8, we'll close by 7. Then with this, we'll now, okay, so we have selected 10 community that we are going to visit in next month. So we'll now give a timetable to each and every PDX radiographer. Now I'm just talking on my own machine. I'm covering 4 local government. So my data assistants actually play a vital role in the success from my site, because she spoke like 3 or more languages, of which my area is being divided into almost 3 or 4 languages, which is Fulani and Tangale. She's from Tangale. So that's how we'll be able to like communicate to the people in the community. After all this awareness, then on the day of the outreach, what we normally do after we have like take our machine from the medical store and reach the destination, we have set everything for the screening. So what we normally do after people have been gathered in one area, we now, okay, give them an awareness on what we are going to do to them. We are here to do chest X-ray screening, and we are like going to, this is our main concern, but everybody can come and test his chest so that at least you will know his health status.
Yeah.
So with this, communicating with their languages, so they feel like you are one of them. So they will give you maximum cooperation. So
Well, that's
apart from this, there is challenges faced during these outreach.
Hold on, we'll come to the challenge. We'll come to the challenge.
Okay.
We don't actually have much time. So I hear you
Thank you very much.
emphasizing the role of good planning. Good planning, not just good planning, but joint planning. Because you plan with the
Yes.
program manager, you plan with the local government supervisor, and then the PDX team. Then one very important thing that I want every participant to grab is the issue of community engagement. I heard you highlight how advocacy to community leaders was able to open the pathway for you. And there's one strategy also that I want us to take note of. They leverage on community members as part of the team. That is very important. We are from northeast of Nigeria. I am from northeast of Nigeria. In my own state, there are over 70 tribes. Gombe is also multilingual. So it's very important to cash into this. Then lastly, the sacrifices that your team have to make to respect the time that is given by the community leaders. Let me quickly ask you how you ensure that the mobile teams are well supported, motivated, and able to maintain this high performance.
Thank you very much, sir. Hello, can you hear me? Yes, I heard the question.
Oh. Hello,
can you hear me? Yes.
Can you hear me now, Salisu?
I can hear you, sir.
Can you hear me?
Yes.
Sorry, is anyone here?
Hello.
Hello, I can hear you.
Okay. So thank you very much, sir, for this.
Okay, good.
Hello, am I audible enough?
Yes, you are. Go ahead, please.
Okay, thank you very much, sir, for the question. Actually, what happened in my state is that, as I've mentioned earlier, that we work in collaboration with so many organizations such as the LTR, Superbill, and others. So during our outreach, LTR sponsored the outreach by bringing car hire from the point where we pick up the machine to the destination area and then coming back. So we were able to achieve this milestone through the support of LTR and the state program manager, because they give us a lot. Actually, we are really thankful to them. Over. Hello.
Oh, okay. Thank you, Salisu. The network is really an issue here. So, and I still have, if you can hear me, I still have one last question for you.
Okay.
I know that in the course of your work, there are some persistent kind of challenges that you still face, and then you will need some support, maybe resources. So I want to know, what are some of those challenges that you actually face, that you still face while you implement, and what additional support would you need to make more difference?
Okay, thank you very much, sir. Some of the challenges faces during this outreach, actually, like some, if it's been divided, according to me, it's been divided into three. One, challenges faced in the community. Then second, challenges faced from the FDX machine we are using. Then thirdly, challenges faced with the transportation issue. Because let me start with the last one. In terms of transportation issues, sometimes you find out that you'll be given a car hire in such a way that some hard to reach areas, you have to drop that car and get this motorbike for you to reach your target destination. So sometimes you have to you go there, for you to find the Okada man to take you to your destination is going to be a really hard to get, of which sometimes is a limiting factors to our outreaches. Some areas cannot be reached actually, maybe due to the all this erosion and the lack of bridge and whatsoever. So this is one. Then secondly, I would like to talk on the challenges faced in the field, because what I noticed during the field work is that most of those people that are that needs this screening does not come because they were thinking there is something that will expose their health condition. They don't want to participate. And also in some communities, you find out that it's only the women that are coming out to participate, while their men are just hanging around. They will just send their women. In some communities, they will be asking like, okay, what have you bring to us? Because some people, if they came, they used to give money and foodstuffs, something like that. These are some of the challenges faced in the community. Not only that, some they will tell you that they need an instant drugs. So you have to explain to these people that we are not giving drugs instantly because our screening is a two-way screening. After screening with PDX machine, if you are presumptive, we'll now collect sputum from you, we'll now go and do laboratory work. So after it has confirmed that you are positive, then we'll now place you on drugs. These are some of the challenges. Then from the machine, sometimes you need a network for you to like offload or do some of your activities. And some of, based on my communication with some of my team members from various states, is that you find out that they have to travel from far away from their destination to like offload, or if they are having issue with their Cure AI application, they have to like go somewhere and give access to their computer. I don't know whether if there is a way this thing can be like adjusted or look at.
Okay.
Thank you very much, sir.
Yeah, Salisu, thank you very much for this. I think personally from my end, I have an internet issue, but I'm able to get a few of what you said. I think I would like to move on quickly. It's Dr. Kaya Akanga around. Oh, sorry. So I think I'll move quickly to Dr. Eze. Dr. Eze, I'd like to bring you back as we try to wrap up this particular webinar. I'd like to ask you, looking ahead, what is one change or any improvement that will help you to close the TB case detection gap even faster in your context?
Okay, thank you very much. We cannot overemphasize on the need for stronger collaboration. Stronger collaboration means that every stakeholder is in line with the project objectives. And the stakeholder, I mean, includes the AI companies, includes the hardware companies, okay? Because if the AI company is up and doing, we are not going to have issues where you go to field and then equipment malfunctions, AI scores are not being generated. If we have the hardware companies up and doing, the turnaround time for equipment repair, turnaround time for replacement of spare parts, will be greatly reduced. Now, the other key stakeholders are the National TB Program, the KNCV being the implementing partners, the State TB Program, and all other partners, those that are supporting the transportation, okay, of radiographers to the field, okay, making it seamless for these radiographers to access transport services to move them into the hard-to-reach area, okay. And then the commitment from the field staff, okay, and also the facility that these X-ray machines and AI have been placed in the States. As you know, we are operating a 50-50 model where we are directly responsible for paying salaries, of 50% of radiographers, and the state government are responsible for taking care of the remaining 50 in their states. If every stakeholder comes together and we make sure that we work seamlessly as we are trying to do at the moment with the national TV program guidance and leadership that we are experiencing now, which is quite good, then I believe that, in the coming year, you will see a whole lot of achievements, compared to what we have on ground today. So I think we cannot overemphasize the need for stronger collaboration among all the stakeholders. Thank you.
Thank you very much, Dr. Eze. Thank you very much. Of course, you cannot, you cannot overemphasize the importance of a stronger collaboration. And I see, yes, the role of the importance of making sure that the AI companies are really up and doing, and also the hardware companies. And I know how frustrated it can be. I mean, how much frustration comes with when you expose people and you're not able to generate a score, or when the image is not being able to move from the generator to the DR panel and all that. And I think I also see very clearly your point that definitely all partners that are involved must have the objective in focus, objective what we want to achieve at the end of the day. This is very, very critical for us. So I would like to ask again that as one of the challenges that I see, that I experience in my own team out there lately, is issues around the logistics that have to do with GeneXpert site itself. Whether the machine is working, you find a 4-modular machine with only 1 module working, or sometimes you don't have GeneXpert cartridges or other consumables. How much of this has affected your own area? How much of this has affected your own work in where you're implementing? Over.
Yes, thank you so much, Dr. Stephen. You are actually pulling out the challenges. Surely, the emergence of AI and the portable digital X-ray have thrown up more presumptive, more than what we used to have before, especially in the community. And what we've started doing is to sensitize the lab officers across the states to prioritize samples coming from PDS, knowing that PDS and AI, is an evolving intervention, and then also a fast-paced intervention, and they depend on these samples being processed before we can move on to the next level of making molecular diagnosis from this sample. So what we try to do is to sensitize them across the state so that each time samples come from PDS intervention, it's seen as a sample that have to be processed very fast. And then we're also prioritizing using other sites other than GeneXpert site. We want to use TB-LAM site, TrueNAT sites, to process these samples. They are cheaper, and then ultimately that they can also be done under our usual weather condition, and samples are processed faster with them. We also have a sample redistribution, so that you move sample from lab that have a lot of volume to the ones that have lesser volume. So all of these are the things we factor to ensure that we have seen less operation in the field. But ultimately, we are looking out for a time where we can begin to couple 1 PDS per 1 diagnostic platform. It looks, like an ambitious dream, but it's achievable, because you imagine if you put in, couple a PDS platform with AI, a TrueNAT machine, and you allow them to work together. What it means is that the time to diagnosis of TB is shortened drastically, because once you get a presumptive, within hours, you can process those samples and know those that are, TB cases and those that are not, and then you know the ones you are prioritizing for clinical diagnosis, just like I see in the question. Following our national algorithm, we have an algorithm that we actually follow that helps us to diagnose both bacteriologically and then clinical TB cases here. So these are some of the practices, although the challenges are still there, but I know we are going to get better as we go. Thank you.
Please, the question will be, that if you could give one piece of advice to other frontline teams or state leaders, in the country that is doing the same thing, trying to address the same objectives with us, starting this journey, what will that advice be?
Okay, so my advice to every partner, to every key stakeholder, to every player is
Did you
resilience. Yes, I do. Can you hear me? Okay. So my advice is for us to be resilient. This is a new yes. Can you hear me, Dr.
Yes,
Stephen?
yes, Dr. Stephen, we can hear him.
Okay. Okay. So my advice to everyone on this project is for us to have that resilience to continue to push because I do know that when you begin something new, it looks difficult to accomplish, but with time, more understanding, more ease, and more ways, become open for us to know how to implement better. So everyone should just continue to push, and then with time, this project will change the narrative of the landscape of TB diagnosis in Nigeria entirely, as it is already doing. So thank you very much.
Okay, thank you so much. Thank you very, very much, Dr. Eze. Thank you so much to our wonderful panelists for the time. Unfortunately, due to network issues, Dr. Kayo was not able to join. We have been trying while the program was going on, but it wasn't able. For the closing remarks, really love to welcome Dr. Emperor Ubochioma, who is also here to give the closing remarks. Welcome, sir.
Thank you, Cherechi, and thank you for the rest of the panel and all the people that have joined. I think this is a great moment and a great time that ending TB strategies have become a very key, important aspect of our interventions as a program, as a country, and also globally. And I think this tool, the mobile X-ray PDX and all the AI tool, certainly with the use of the AI, has changed the dynamics of TB diagnosis and management globally. So I think we are here. It was a very beautiful discussion, and I think I will encourage for more of this time to time for us to also make sure that people are braced properly on how to address some of the challenges. One of the things I must put in place is that all stakeholders, in the absence of GeneXpert, should also try to use other diagnostic tools that are available within the country to address. Global shaking on finances are affecting a lot of things, so we have to begin to domesticate and also try to work within the available things we have to get the diagnostics done. In all, I think we have done a very good job, and thank you everybody for coming. On behalf of the National Coordinator and the program, we say thank you for this meeting, and thank you QI for this wonderful webinar, and we thank you for bringing us on board on this kind of area, and for all the panelists, my friends and colleagues around. I think I will say thank you. I think Dr. Stephen is not there, but I'll still see him in country to say that was a good coordination, and thank you everybody for that wonderful meeting, and I wish everybody a wonderful day and a wonderful week ahead. Thank you so much.
Thank you so much, Dr. Emperor. Thank you so much to the wonderful panelists and teams that we have and the project going forward in making sure that we really eradicate TB in Nigeria. And I mean, as a company and partners as well going forward, we do really want to ensure that, yes, we're going to make sure we make things easier going forward, making sure that these little challenges that we have been coming up here and there will be resolved accordingly. So thank you so much. I don't know if there are any questions going on. I think I could see some questions coming up. Okay, they're all good presentations. Yes. So thank you so much for the wonderful statements that are being made and for wonderful statements of support. And I think we'll be rounding up the call and the webinar here. Thank you so much for your time, and God bless everyone. Have a wonderful day ahead. Thank you.
All right. Thank you. Bye.
Thank you.
Thank
Bye.
you. Bye.